Really grateful to Wes and Ruth Ann for joining. Hold on. And if folks have questions, feel free to put them in the chat box, and I will keep an eye on that as things are moving along. So we welcome your questions and your thoughts and your comments. And we'll get started in about 30 seconds. Okay. Just about done setting everything up. Great. Okay, here we go. Great. Well, welcome everybody. We have a nice crowd. Great to see everybody on today. And thank you so much, Wes and Ruth Ann, for joining. It's wonderful to have you here. I'm Delegate Brooke Learman, and I represent, along with my teammates, Senator Bill Ferguson and Delegates Luke Clippinger and Robin Lewis, the Fight in 46th District in the Maryland General Assembly. We represent part of Baltimore City. And of course, although we represent the 46th, we do work at the state level to try to pass and implement policies that fight inequities and build healthy housing around the state. So I'm thrilled to have with me today two amazing people, heroes of mine, who are doing work at the local, state, national, international level, promoting healthy housing. So before we begin, I just want to make a few points about where we are today, why I think it's so important to host webinars and briefings like this. So, I really believe that as an elected official, we have a much bigger job than just passing legislation. We have to be connecting people with the resources that they need, driving discussions about important topics like this one, and advocating for change in multiple ways, including through discussions and information sharing. And, I think Wes and Ruth Ann will both agree with me that government is really about reducing barriers to success, creating opportunities for all. And part of that, of course, is keeping our residents healthy and safe. And we know through this period of the pandemic and now the economic recession that people are living paycheck to paycheck. They're facing huge challenges, and many folks didn't have a cushion, right? They're feeling this economic shutdown even more acutely. And we know, for instance, that people who live in polluted communities are more susceptible to the effects of COVID-19. We know that people of color are dying at a much higher rate than white people from COVID-19. So in other words, as I like to say, and I didn't make this up, I saw it somewhere and I stole it, we are all in the same storm, but we are not all in the same boat. Some people's boats are very weathered and full of holes, while others are on luxury liners. And so we have to make sure that everybody, that we're capturing, that we're taking care of everyone, even those who came in on dinghies, if you will. So we have the luxury of sitting in our homes and discussing these life and death issues only because, of the people who are out there today working on the front lines, right? Our food workers, our farm workers, our transit drivers, doctors, nurses. So I'm so grateful, and keep in mind that those workers, our essential workers, are often some of our lowest paid workers as well. But they are keeping the economy going and keeping us fed, and I'm so grateful for their work, and we owe them a lot more. So, why a webinar on healthy housing? I'm sure both of our panelists will have a lot to say about that, but earlier this month, I hosted a webinar on housing Marylanders before and after COVID, where we discussed the impending housing crisis as courts reopen in Maryland and rent relief programs and free legal aid are really scarce. But on top of the issues around evictions, our state in Maryland has been dealing with systemic issues around access to quality, affordable housing for a very long time. And Baltimore in particular has been in crisis mode really for decades, dealing with housing discriminations, contaminants, lead, mold, roaches, you name it. My mom, I don't know, Wes and Ruth Ann, if you know this, my mom was a nurse practitioner at a community health center in DC for many, many years. And she used to say to me, Brooke, like, I can give somebody an inhaler, but what they really need is a house that doesn't have roaches in it. and, that's clean, that doesn't have mold. So she could only help the symptoms, but she couldn't solve the cause of the problem. And, I think it's important as we analyze the role that the housing sector plays in perpetuating inequity in Maryland and across the country. We remember that Black Americans are more than 2 times as likely to die from asthma as white Americans. And addressing asthma and addressing healthy housing is absolutely an equity issue. And so I'm really excited today to have Wes Moore and Ruth Ann Norton here to talk about some of these systemic issues that we're facing, the inequities that exist, and how we can start moving past this. I think one of the things about this crisis that's so interesting is, we have to use it to reimagine what's possible and work toward that. Not just say we've got to get back to where we were, because that wasn't good enough, right? So we have to use this time to think about how we can make things much better than how they were before. So really thrilled today to have Wes Moore and Ruth Ann Norton. Wes Moore is the Chief Executive Officer of Robin Hood, one of the largest anti-poverty forces in the nation. He's a best-selling author, a combat veteran, and a social entrepreneur. Wes's first book, The Other Wes Moore, which every book club in America has read, including mine, is a perennial New York Times bestseller, captured the nation's attention on the fine line between success and failure in our communities and in ourselves. Wes's next book, 5 Days, has just been published. There we go, there it is, with one of my favorite reporters, Erica Green. I can't say she's my favorite New York Times reporter anymore because Water from the Sun has just joined her at the New York Times.
That's right.
But wonderful reporter, and it's a wonderful book that's now available by Penguin Random House. And it explores the uprisings in Baltimore in 2015 after the death of Freddie Gray in police custody through a kaleidoscope of perspectives, and examines critical questions about the deeper causes of violence and poverty. Wes grew up in Baltimore and the Bronx, where he was raised by a single mom. And despite his challenges, he graduated Phi Theta Kappa from Valley Forge Military College and Phi Beta Kappa from Johns Hopkins. He was also a Rhodes Scholar and a captain and paratrooper with the U.S. Army's 82nd Airborne, including a combat deployment to Afghanistan. So delighted to also have Ruth Ann Norton, who is a District 46 constituent. Wes is a Baltimore, but we can't all live in District 46, so, I forgive you. Now, Ruth Ann Norton is the president and CEO of Green and Healthy Homes Initiative, a nonprofit organization founded in 1986 that's dedicated to the elimination of childhood lead poisoning and the creation of health, safety, safe, and energy-efficient housing for America's children. She's a strong and vociferous advocate for healthy housing and health equity. And she broadened the mission of the organization by designing and implementing an innovative model in 2009 in partnership with HUD, CDC, and the Council on Foundations that's built on a framework of cross-sector collaboration that cost-effectively integrates resources to comprehensively deliver asthma, lead hazard reduction, healthy homes, weatherization, and housing rehab interventions in low-income homes. Really phenomenal work. She is also the architect of the state of Maryland's 98% reduction in childhood lead poisoning. So really happy to have you both here. Today, we're gonna let you all talk for a little while about your work, about your vision, and then we're gonna open it up for some questions that folks put in the chat and that folks had submitted beforehand as well. And we'll go through those questions and just open the discussion. So I'm thrilled to have you both here. Thank you so much for joining us. And who wants to start?
Ruth
Well, Wes, age before beauty, so you go first, my friend.
Okay, we'll turn it over to Wes. You're up.
There you go.
All right. Well, at first, let me just say,
younger age, I would say. Younger age.
First, I just want to say thank you to Brooke, the Delegate Lemon, for this opportunity and for your leadership. I think you consistently push us to be better. You push all of us to be better. And you said it's a real honor to stand with you, not just today, but honestly, it's a real honor to stand with you every day.
The feeling is mutual, so thank you. No, we're trying to live up to all the work you guys have done.
Thank you, and to Ruth Ann, one of my dearest, most treasured friends. Ruth Ann is a person who serves as not just an important leader in my life. She's an important conscience in my life. and have the chance to share this screen with her also is just amazingly humbling. So much of what I know, so much of the work that I do, so much of the push that I have in this work is because of Ruth Ann. So it's a real pleasure. And I'm going to, especially knowing that Ruth Ann's going to follow, I'm going to be brief because honestly, I just want to listen to her all the time on these issues. But I just want to, say that when people talk about, when I think about the work that we do, so Robin Hood, as Delegate Lehrman said, is one of the largest poverty fighting organizations in the country, and we focus on everything from housing to health to food. To criminal justice reform, to housing, to transportation. Really what we say is everywhere where poverty is either the cause or the consequences, we will be there. We will fight, we will build, we will fund, we will create if necessary. And we will advocate when necessary as well, because I'm also a big believer that the reason that we have so many of the challenges that we have as a large society isn't because philanthropy hasn't done its job. It's because we still have policies that are both putting people and keeping people in poverty.
Yep.
And those have to be addressed.
Yep.
But when people say, so what's the thing that you can do or the thing you can invest in that's going to make everything better? And is it education, or is it early childhood development, or et cetera? The answer oftentimes is yes. It's all of it.
Right.
Because the way poverty shows itself, it shows itself in every single way. It shows itself in the air that you are breathing, in the homes that you are living in the schools that you attend, in the food that you are eating. In every single facet of your life, it's present, and it's a reminder of the fact that you don't have something that other people do.
Yeah.
But there is no place that it shows itself more than in housing. And the challenge of housing is that housing really serves as the fundamental foundation of, it's the first time where we're being told what people think of us without saying a word, just by looking at where we're being asked to live.
That's right. That's a good, yep.
It's the first time where our future is being spoken into us completely inaudibly, just simply by asking a person, where do they call home? And what does that mean to them? And so when I think about the work that not just we do at Robin Hood, but the work that's being done around the country, the work that GHHI is doing all over, not just in the state, but all over the country. This work matters because as we think about the levels of disparities that we see, there's two things that we know about it. One is that the disparities are remarkably intentional. And I think it's important for people to understand that and for people to be able to embrace that. The fact that we don't have these separations by accident. We have these separations because we've watched a fulfillment of laws and intent. You can't understand what has happened in Baltimore City or in the state of Maryland, without understanding the intent that was then set out and the way it showed itself specifically within housing policies, and how that then rolled over into healthcare policies and education policies, because all of those things have secondary and tertiary impacts. The other thing, though, we have to understand is the only way that we can actually address it is if we're willing to be just as intentional in the unraveling. That we're not going to be able to get there by moving and nursing around the edges, particularly on things that there's no reason for them to exist now. Ruth Ann and I, we have these conversations all the time. The fact that we still, right now, have children that are living in homes and drinking water that has lead-based poisoning, even though we have now known for over a century of the impacts, where we're just not being deliberate. And just the truth is that the way we're treating it and dealing with it is still very much class and color coded.
Yep.
The fact that we know that this solution is not beyond our reach. I mean, we know that the resources can be marshaled and we can meet the scale of Baltimore's housing problems.
Yep.
We know we can do this. The question is really, it's a fundamental question that comes down to one word, and that's just will. And so, I know we're gonna go deeper into this, but I'm excited to have this conversation because, again, the solutions are there. How do you deal with indoor air quality? How do you remove asthma triggers? How do you do this work? How do you make sure that we can better support not just younger Marylanders, but seniors as well? We know how to do this. the question comes down to will. And so I'm thankful for the chance to be here today, but also just really thankful for the fight that continues to take place every single day in this work.
Thank you for that. I mean, you're absolutely right. And I think I love that line that, you know, the housing is the first time someone tells us how they feel about us without saying a word. I think it actually, it reminds me of, I represented a few young girls to get them green cards. They were undocumented. They'd come here, and one of them started at the ACE High School this year which is amazing and beautiful now, right? It's this incredible new 21st century school building in Baltimore City, unlike many of our school buildings, which are crumbling. And she and her mom walked in the first day and they started to cry. And she said, it's like a palace. You know, she'd never been in any place like that. And it reminds you how important it is, how kids get it. Like they see when they walk into a crumbling school building, what we think they're worth, right? And, you know, it's why it's so important, you know, that we have these buildings. I mean, it's one of the many reasons, but yeah, that was it. You said that very well. So, Ruth Ann, thank you for joining us. Thanks. You're such a leader on all this work, and your vision has really propelled forward so many of the policies that we've been able to change. You know, when Ruth Ann comes to Annapolis, people sit up. The chairman listens, you know. Oh, that's Ruth Ann Norton in the front row. She's testifying.
There again, she's there
on. Yeah. So delighted to have you here. You know, please share with us your perspective on, you know, where things are today and why we haven't made more progress, and how COVID really like highlights, I think, some of the inequities that already existed.
Yeah, I'm going to go a little bit back and a little bit forward on that. The first thing I want to do, Brooke, is join with Wes and thanking you. I am so blessed to have you representing me in the legislature. And if every legislator was like you, that actually listened and thought about things and came back with questions that are hard enough to answer, that I have to go research and find answers and cares to follow up. I mean, just good on you for the public service that not only you, but others in your family have continued to do. And I saw your brother's post on Loving Day the other day.
Yeah, yes. They made a little video. It was awesome. Yeah.
Amazing. But it's so amazing. And Wes, my brother, my friend, my soulmate in many ways, please, you know, tell Dawn she has to share with that. But there are people in the world who can raise voice to things you care about so well. And so thank you on behalf of all of our kids and our seniors that we need to help, right? And as I was thinking and listening and thinking about your new book, which I have ordered and I'm waiting to arrive, you know, we can think about the life of Freddie Gray and encompass almost everything we are talking about. Mm-hmm. A child who was the first day that I took my job, he had his highest lead level. I did not know him, did not know his name, never had a chance to advocate on his behalf. But it was stunning when Gene Marabella and the guy from the Washington Post called me to talk about the toxic legacy that led to so many of the obstacles in his pathway, around asthma in his house, around lead. But we have tens of millions of children waking up every day, and tens of thousands of kids waking up here in this region, still facing that moral compass that we have in America about unhealthy housing. Mm-hmm. We sit in a city where we have lowered the rate of lead poisoning by 99%, where Duke University says that we've returned $44 billion back to the Maryland economy by doing that. And yet we can walk outside our door, we can walk within blocks of our houses, and we can see still the disinvestment and how deep the disinvestment and the conscious and unconscious collusion that led to the absolutely racist policies, the absolute policies to want to disenfranchise the poor, that where a child is laying their head down at night, we still have not had the courage or put the priorities in budgeting to change what we know. I was listening to you, Wes, and thinking about, decisions that we've made in the United States. And I could talk to you about 1904 when the Sherwin-Williams Board of Directors had a meeting and said, we will not enter the lead-based paint market because it kills babies and harms pregnant women. And in 1908, they entered the market because of money. Mm-hmm. In 1937, this country had its first and only uniform housing code policy. And was moving forward to try and protect the health and safety of families coming out of the good work of nurses, right? And in 1938 made a federal decision to use lead-based paint in low-income housing, knowing what they already knew. And what they already knew was in 1921, the League of Nations, the precursor to the United Nations, banned the use of lead-based paint around the world, and the only country not to sign that agreement was the United States of America. So it took till Teddy Kennedy introduced in 1977 a ban on the interstate sale of lead to protect most kids in the United States. But how bad this problem about housing, how we make decisions about housing, lead is one major and terrible symptom of that, is we banned it in Baltimore in 1951, and we are still talking about
dealing with it.
There are still kids in juvenile court whose brains have been so damaged, whose decision-making mechanisms have been so damaged only a couple of years ago, where we have a 99% reduction. But it's, we're choking our kids with asthma, and it's the number one reason they don't get to school. Right. Number one reason. We have lead in paint that damages brains, but we also have lead in water that still exists in the Baltimore City school system. Yeah. When that issue was raised by a parent by the name of James Williams in 2001, because his daughter was lactose intolerant and needed to have water and not milk at lunch, the principal said, don't drink the water, it's got lead. Because in 1988, the EPA told the city of Baltimore that your schools have rates of lead in water that were off the charts, remain off the charts. And while Brooke, you are a great ally in this, and Jared Solomon and Robin Lewis are great allies in this, we still have yet to get our legislature lower the levels of lead, the acceptable levels, to force our schools. And when we put the bill in this year, it was opposed by the Maryland Board of Education. Yeah. And how do you want to educate children? We should be proud in building our public schools. Yeah. We should make sure that when kids go to school, they're being educated and not poisoned. But this is, I think a lot about this, and we can talk about a lot of it, about the human toll, the health effects of kidney damage that leads to hypertension, that lead leads to a higher rate of cardiac arrest. And we can write all of these racial disparities, and it will go right on the black butterfly of West Baltimore and East Baltimore. It will go right to our Black and African American and Black and brown communities where we are still dealing with this. Mm-hmm. And we have the issue of seniors trapped in houses that they cannot age well and safe in, because they will suffer from respiratory. And those same houses, in order to flee that or not be able to afford to fix what was undermined by our policies, we stopped the intergenerational wealth transfer of real estate of value that we take for granted in the white community. Yeah. So we have so much, but I want to tell you the one thing that I also think about today, and I think about as you were having this discussion, is Elijah Cummings, who was near and dear to all of us. Mm-hmm. He and I took a walk through many of these neighborhoods together, and he suffered from asthma. And he said to me, we have got to stop the normalization of these conditions, that people will know their child's lead level quicker than they'll know the name of their school or their teacher. Right. We just assume everybody will have lead, we assume they have asthma. Right. But I think if nothing else about today, we can no longer, with the protests, with the voices about police and police budgeting and brutality and racial terrorism is telling us is that everything needs to get rebuilt, and we can no longer say we can do it at small scale. If we care about change, the scale has to change, whether it's philanthropy, government, and companies. If we want to build a better workforce, we need investment in where children lay their head down at night. If we want better education, people who are funding for graduation rates have to fund for lead poisoning, because 7 times greater likelihood of dropping out of school with lead. So I'll stop there for what we can do and questions and thoughts around that. But this all leads to eviction. It leads to all of the disinvestment, and it leads to the larger issues of outcomes.
Yeah.
And we've got to understand that no one wants to live in neighborhoods that are toxic. Not one person wants to raise their child there. None of us would be willing to be there.
Yep.
And what our society will be in the difference, if we make the investment, how much we will capture of the greatness of kids yet to grow up by doing what is cheaper than the medical bill. So I'll leave you with one small thing. We can invest about, $1,500 to $4,000 in a house and eradicate the things that are exacerbating asthma. Or we can pay $25,000 for a kid to go to the hospital and be hospitalized, miss school, get behind, parent not go to work, get fired. That's way more costly.
Right.
We have better options.
Right.
And thank you, Brooke, for giving us the opportunity to talk about it.
Yeah, no, thank you. Thank you for all your work. So there were some questions that were submitted beforehand. I'd like to just, honor the folks who took the time to think through this and who are on the call today by raising some of these issues. And there were a couple of questions about the correlation between communities impacted by lead poisoning and communities most impacted by COVID-19. And, I have not done the layover of the maps, but I'm going to take a wild guess that there is a high correlation. But I'm curious if either of you have looked through any of this or have any thoughts on the correlation of those communities and outcomes. I don't know. Ruth Ann, have you taken a look at it?
So first of all, I'm fortunate to have Beth Lauer on our board, who's running
Oh, yeah. She knows all of this data.
Piece. And very early on, Doug Nelson, who works with us as well, former CEO of the Casey Foundation and a friend of everyone here. We had a conversation with Beth early on, and she said, if there's one thing that's common around this, it's where housing, right? And looking at this data. But I also want to say to people, why are we surprised? After Katrina, we were surprised that there were poor African Americans in New Orleans. Like that was a discovery, right?
Right.
And
couldn't get out. Yeah.
We are, and thank you to Nick Mosby for his push on this, because he really pushed the nation to think about this. But there's no surprise in what we know. Asthma is an underlying condition that they've talked about. Health conditions are underlying conditions, right? But we are asking people to shelter in place, use homes as their protection, homes that are full of lead, full of mold, mildew, moisture, rats and mice and pests. So we have not only, it's an absolute lay it on there to the T almost on this, but it is something that we have to fix, because we're not through the coronavirus. We're going to have seniors for years who will never want to come out of their house a lot because they're afraid. We've got to get busy. I think of this one thing, and I think I've said this to Wes, we are working with NYSERDA in New York because we have an extraordinary concern, not only in New York City, but about older adults who are now running into June, July, and August, who have been told to stay home, who would normally be going to cooling centers, who do not have proper cooling in their home.
Right, sure.
And my fear in St. Louis and Detroit and Philadelphia and Baltimore and everywhere else is, if you want to accelerate a death rate, put an older adult in somewhere that the heat index in their own home is going up. Sorry, I get a little passionate.
I'm curious, Wes, if you're seeing from your grantees or from the work that you're doing, around correlation. Of course, you know, the correlation between people living in unhealthy housing and death rates and infection rates on COVID. Is this coming bubbling up to you?
Absolutely. And first, here to everything that Ruth Ann was talking about. I mean, the danger that we saw when COVID-19 hit is actually in many ways, you could just say it's the danger that we saw within poverty. And that's the fact that we knew how predictable this thing was going to be. We knew immediately how predictable the impact was going to be on COVID-19, because it all, you know, the danger of COVID-19 is that it attacks vulnerabilities. I mean, literally as a virus, right? What it does is it literally attacks the vulnerable. It attacks vulnerabilities, because if people have healthy immune system, don't have pre-existing conditions, this thing could be dangerous, but doesn't necessarily have to be deadly. In fact, if you look at the numbers, the vast majority of people who will contract COVID-19 will get sick, but will survive, right? Where that gets complicated is when you're talking about communities that are already suffering vulnerabilities, pre-existing conditions, and in many cases, a whole battery of pre-existing conditions, many of which that we talked about today. So for example, things like asthma, right, is a massive pre-existing condition that COVID has an absolute stranglehold on. And the survivability rate for people who contract COVID, who have asthma or diabetes or high blood pressure or heart disease, those fatality rates are the ones that are skyrocketing. So it's an illness that absolutely attacks vulnerabilities. And so just like poverty, one of the greatest dangers of poverty is how predictable it is. We saw the same thing when it came to the overlap of people who are in unstable housing situations and those who both contract COVID, and then also those who then will eventually, who potentially could die from it. And the interesting thing about Baltimore in many ways was two of my greatest frustrations about where we are as a city and the things we've allowed happen, actually in some ways were things that helped in the COVID fight, right? One is one of the greatest dangers that we have within COVID is just, it's in a word, it's density. Right? It's a compiling of people on top of each other. One of the reasons why New York, frankly, got hit so hard was the level of density within New York City. Baltimore, because of a population decline, and again, something that I think each and every one of us should be concerned about and doing something about, but in many ways, that actually helped out when you're looking at the fact that we didn't have the same level of density, with the exception of exactly what Ruth Ann was talking about. Right? So you saw how COVID-19 hit certain areas and communities harder because of this issue of density. One of the other big issues, though, is public transportation. You know, Brooke and I, you know, we spoke about this at nauseam. The lack of mass transit and public transportation assets that we have in this city is unconscionable. And frankly, for any policymaker who has spent time not even advocating for it, but actually killing it and pushing it, that should be a non-starter and a non-negotiable for your position to be able to sit in a certain office, right? But we also know that so you take an example, for example, places like New York or Los Angeles or even Washington, D.C., mass transit was one of the places that really had to be understood and controlled best when it came down to the control of COVID-19. But when we think about it from the housing perspective, one of the first things that we advocated for coming on board was going to be on the issue, and you mentioned it before, was on the issue of evictions. We knew once you had such a significant shutdown of the economy, a quick and immediate shutdown in the economy, and understandable why, right? But once again, very predictable, who was going to get hardest by this, right? Those who we already knew, which was over 40% of the population in this country, who could not afford a $400 shock with cash.
Wes, you should know that I'm trying to get George's Clements and Just Fix, who came out of your incubator at Robinhood, who I'm now helping to give some mentoring to. Robert Wood Johnson asked me to do that, and we've been on the phone a number of times. I'm begging him to bring his online ability to do rent and housing court through technology to Baltimore.
You want to, but do you want to share, or I should share? But you should share it, because it's one of these things where it's difficult to say which one of your community partners you like best. I kind of asking which child you like the best. But please, Ruth Ann, please talk about Just Fix, because this truly is one of my favorites.
Well, Just Fix is fantastic, and first of all, I think George's is like 29 and brilliant.
Of course,
and to save the world, but he has figured out something that we found out during COVID, right? The ability to use technology, which I want to talk about really quickly. But the ability to use technology to make sure that folks are not going to get evicted illegally, that they will have housing protections. He's been able to figure out how to get it down to your phone and be able to file in court to prevent bad things from happening. I mean, and it was coming online to work that way. Anyhow, COVID came and the need for it went sky high. So when we've been talking about his work and how it can relate to the healthy housing work and making sure that things like lead, asthma, pest, energy efficiency are in that and paying attention to it, I've tried to bargain and say, you'll get all the free advice in the world, but you got to come to Baltimore.
Yeah.
We need a better way to document
Right.
what happens in housing court. Because in housing court,
Yes.
90% of the time, the rental property owner will have legal counsel.
Right.
And less than 9% of the time,
the renter. Yeah.
Right there. But if I can.
And there was just a great report on that, actually, that the Public Justice Center did a press conference on a couple of weeks ago on the importance of legal assistance for renters, and actually how it would bring down costs overall to Baltimore because people would stay housed. Sorry.
And where you're really going to see that too is the tidal wave that's on its way once the moratorium on evictions ends.
Yeah.
Sorry.
I know, but we're supporting that right to counsel work, and Ludine on my staff is pushing on that. Really.
Yeah.
But, thinking about this technology really quick, so I love my staff, there's no doubt, and they are amazing. But we shut down very quickly, right? As soon as we started to figure out what we need to do, we shut down, got people to set up remotely. But our lifeblood of what we do in Baltimore is to get inside your house and try to fix the things that are wrong.
How do you do that now?
Right? We immediately moved to a virtual platform for education, asthma control test, and then started doing virtual home assessments. So we are doing the assessment of hazards in the home using Zoom, Doxy, FaceTime with our clients and people in need and people that we're getting referred, both seniors and kids, families with kids. And what we have found is a couple of things. So we're doing this for AmeriGroup and here and clients that we're doing it with Integra, two managed care organizations. We're starting to do it with DSS and the foster care program. We're looking to do this in other places. I'm presenting to the federal panel on this next week. We have found that we've been able to have higher engagement and we feel that using the technology will set up a more trusting relationship for the time that we actually go to knock on the door.
Right. That's interesting.
Met our folks, they will have built a relationship. We have been amazed at the technology abilities of that. Everybody always tells us about the things that we need, and there's certainly a digital divide. But mobile phones have been a godsend.
Right.
And so our ability to do that, the amount of work that we can do to pre-evaluate a home that will save us money, save government money, when we go to actually do the work, that we won't show up, do an assessment and say, they don't fit, and we got to do some other things first. We will have gone past those hurdles. But most of all, we're building engagement and trust. The bigger, but our team changed immediately. The guys who are normally putting in windows and fixing lead paint or fixing a leaky roof are out delivering food, or out delivering emergency supplies, doing emergency repairs. Mm-hmm. And as we think about going back to work in a more normal fashion, this will now be a permanent part of our lives.
Oh, that's good. Someone just commented, this should continue. Yeah.
We're giving it away. We're going to put it on Project Echo. We're trying to get some foundation support to help us do the whole toolkit on that. But we're going to put it on a platform called Project Echo, and we're going to give it to every nonprofit, every managed care organization, every government entity, health and housing, who wants it, to create a universal platform that protects people on HIPAA, that collects the right but appropriate data, and allows us to move this forward. Because this is not something we should be trying to sell our goods on at this point in time. This is necessary to keep people moving and safe, and to get it so it's trusted by healthcare who can invest in it, who can reimburse. So we're building that capacity, and So, but I think there are many good opportunities that we face to build jobs in community better than ever,
Yeah.
and to build investment. We just
There's
need,
a,
we need
I have
budget.
to I have to point out a comment in the chat box from Sarah Fresh, who used to run the legal aid in the courts. So there's in each of our district courts, there's legal aid direct assistance. And she said, please bring Just Fix to Maryland. So I think.
Well, there's one person on this phone or on this call that has more influence, and it's not me or you. Or I think our captioner, Kelly.
So, I mean, I think this is exactly right. And, you know, I think there was a great question about where will we be in 10 years if we do nothing? And I think it's a scary thought, right? If we were to not sort of seize the moment of where we are now, things will not stay the same. I think they will get worse, right? As our housing stock continues to age and as people are evicted. You know, we had a webinar earlier with County Executive Stuart Pittman, and you know, we talked a lot about the need for rental assistance right now, so that people aren't getting evicted, and so that landlords, small landlords, don't lose their properties to the Jared Kushners of the world, like the companies that will come in like vultures and buy up all of these small properties if small landlords can't get money and can't get help. So there's just so many issues that could balloon. But your thoughts on, you know, what, I guess the question is, you know, what will housing look like in 10 years if we do nothing? And sort of a corollary, like, then after that, let's talk a little bit about what would be the most impactful things that we could do now so that in 10 years, we look back and we say, remember that summer of the pandemic and the protests? That was when things changed, right? That was our 1964. Like that was when we really started moving forward. Curious on your thoughts.
So, I mean, I guess I'll go very quickly and say, to be very honest, I actually, respectfully, I actually don't want to spend time on that question because that's not an option.
Yeah, right. It can't be. Yeah.
That's not an option.
Yep.
You know,
Yep.
I actually, when I think about it this way, you know, what will it look like in 5 years if we actually do something?
Yeah.
Right? Where we know within 5 years' time, there's a whole lot that could happen if we actually choose to do something. Right? We know that we could eliminate lead poisoning inside of our homes indefinitely and for good.
Right.
Literally put it in the history books.
Yeah.
If we chose to do something on it right now, right? We know that for people who are housing insecure, for people, when we think about things like we were talking about before, you know, the looming eviction crisis, right? That the city and the state and the federal government could really put together, you know, policy-driven solutions that is meeting the demand for affordable housing, including fully funding the Affordable Housing Trust and reinvesting funds formerly earmarked for law enforcement, repairing supports for existing housing stock. Like we know what to do. Right. And so frankly, the idea of what will it look like 10 years from now if we do nothing, that is just so unbelievably unacceptable. Yeah. And I really think we have to take an inverse approach. And it's like, what will it look like in 2 years, 3 years, if we choose to do something? And the answer is we would completely reshape our society. Yeah. So certain things that we're dealing with now will literally be history book conversation.
Would be gone. Yeah.
Right. We cannot even discuss racial equity if we don't discuss the houses, which kids. But I want to tell you a quick story. In 1999, 2000, Thomas Frazier was the police chief in Baltimore, and Pat Jessamy was the state's attorney.
Yep.
They showed up at my door of my little organization and said, "We need to help you, because we are tired of arresting and prosecuting juveniles who are lead poisoned." And at that point in time, Baltimore, for over a decade and a half, had never once enforced a lead violation notice. Those notices only happen after kids get really sick, right?
Oh my God.
And the high rate. And that was a great example of how you can, if you think about the role of police budget and priorities, and here was the police chief saying there needs to be a priority here. And we did start to enforce, and we started to change a lot was going on. You know, there's huge opportunity, and I can't let this moment pass without dropping a dime on the fact that GHHI has put into the MacArthur Foundation's $100 and change competition for $100 million to invest $100 million on a model program for Baltimore to show that if you do holistic whole house lead reduction, asthma reduction, weatherization, you will change a trajectory, not only for Baltimore, but how to do it at scale across the country. Yeah. Everybody wants to like pound on people there or wave the flag. I'm not saying we will definitely get it, but we've advanced farther than we thought in that competition. Yeah. But somebody said, you know, you're only talking about Baltimore. And we're talking about Baltimore in the senses because there has got to be tipping point investments. Yeah. But there are things that can be done in legislation to ensure that we're asking the right question of where investments are going. Right. Energy efficiency investments, you know, the Energy Efficiency for All group that we're the health partner for them across the country. But in Maryland, we're not asking the question about where and what communities and what race and economics that we need to be asking or at the data levels that we should. We got to track the money because, and then we have to align that money to get power out of the money. We can't do one thing in a house. When we learned we couldn't just do lead, or we're going to leave behind kids who are not getting to school because of asthma, or they're going to get injured, or they're going to get evicted because the energy bills aren't getting paid and it was a choice between paying your electric bill and your rent. All of these work together. We have to see this model work. If we want to do a model on social determinants, if we want to change educational outcomes that kids can actually learn, can get to the classroom, can compete at grade level reading, you've got to take a look at housing. How many discussions are we in where we talk about unstable, unaffordable, and unhealthy housing? Its tentacles are everywhere because it's our home. It's our home. And so there's much to do. You know, I've talked, I think both of Wes's ears off on, you know, if we can invest in this, we can have jobs that are risk assessor jobs and start to pay people $55,000, $65,000, $75,000 a year jobs with health benefits. Contractors who are cross-trained to do healthy housing make a $4 to $8 premium on their value and get it done cheaper for government. So we have an opportunity to do that, but these are skills. We don't want people to remain community health workers. Right. We want them to become health educators. We want them to become certified asthma educators. We want them to go on to become nurse practitioners, but we've got to build pathways where building that work in housing and taking care of something that people can also see and feel and experience will engage a community much differently. We cannot talk about this any longer. It is, there is no turning back about scale. Scale in the legislation of how we do it, you know, enforcement works, but only to a point. We have to say that we are going to be intolerant about the normalization, about the unconscious collusion, about the conscious decisions that we have made and we own. I think I'm up thinking every day, I think as most people are, about, you know, working hard, but if you're not working at scale, then we are not going to change what everybody's, you know, the protests were 2 blocks from my house, starting at the convention center one day. And I watched all of these young people who were there and peacefully, but strongly demanding that there be real change. We can't look in their faces anymore and give them the same answers, or shame on us. And we have to all fight to our last breath on this one. And it's, I mean, you know, we won't even, we can, if we invest for 5 years in this, $2.5 billion a year, if we could invest $2.5 billion a year for 5 years, we can almost eradicate lead poisoning in the United States. And why? There's a lot of big philanthropy, there's a lot of corporate foundations, there's a lot of corporate money, there's a lot of government money that can be redesigned around housing, and it will do so much. And it cannot be that hospitals only become investors in new housing, because that will be a drip, drip, drip. We have a hospital system in a state that borders here that decided to write a check for $50 million to a town of 60,000 people because they knew that using their hospital community benefit money would change the life trajectory for every child in that county where they are. I can't talk about them publicly without their permission, so I will not do that. But that's life-changing. And that Board of Trustees has made a commitment. And when they go public with that in November, that every hospital has to pay attention to that.
Yep.
Post-COVID, during COVID, we have a lot, because hospital community benefits are the payment in lieu of taxes for nonprofit hospitals. And hospitals have a lot on them, but we want to help them save money. We want our patients to be healthier. It's not the only place we can think about institutional investment. But anyhow, and I'll vote for the bond. If we want the bond, I will vote for that bond to create.
Yeah.
Well, but that's a really important point, right? And because the other thing that people are tired of is the same excuse as to why we can't do anything, right? Because the repeated excuse that we will get is it's too expensive. What's too expensive? Literally, we're talking. I mean, we're talking about the health and fitness of our families. That's too expensive, but we can be very quick within a matter of weeks to drop trillions of dollars when necessary. So what's too expensive? And especially when we have these conversations about things like rates and debt and deficits, and I am all there with anyone who wants to talk about the danger of excessive spending. I get it, I understand it, but you know what I also understand? I understand rates. You know what I also understand? I understand impacts and health, and I understand the fact that it's really and fascinating and frustratingly convenient when we have conversations about what's worth spending on and what's not. And so what Ruth Ann is talking about is absolutely right. We know what to do and we know what it would cost and we know how to think about prioritization when necessary. And so I think there just really needs to be an honest conversation about prioritization, and to exactly what you said, Brooke, Delegate Lerman, we have to build better coming out of this. Not just build, not rebuild, not return. Build better. And that just means being incredibly proactive about the issues that we're talking about here.
Let me throw one number out before I make a nomination of Brooke to be on the vice presidential list here. See that number, 221 to 1?
Mm-hmm.
That's the return on investment for every dollar we invest in lead poisoning prevention in the United States. We return back to communities $221. I don't care how good the stock market has been or not been. I don't know anybody who gets that return.
You ain't getting those returns.
No.
Those are dollars.
Yep.
Not to mention the fact that there will be a kid who will be able to read, learn, imagine, and create, and be able to be resilient and healthy. That is worth $1. That's worth $12.5 billion that we need to raise now in this country to take and say, we care about health, we care about equity, and we care about opportunity, because it is African-American children, it is Black children, it is brown children, it is Hispanic children who are getting pummeled by this. Gotta say no more. More. There are white children who are also poisoned that we certainly want to make sure they're healthy too. But if you want to talk about disproportionality, disparities, inequity, let's go. I just think we need to go. We need to go on this and raise the money, raise the issue, and put people to work in this.
Right.
Because the jobs out of this that can be owned by community, We can do ownership of companies to do this work that will be transportable after we get past this issue. I'll stop.
I feel like nobody has to go to church this weekend, right? Everyone's going to say amen now. This is such a great discussion, and I think it could go on for hours, and I love it.
You got an amen indeed on the chat there.
Yeah. Yes, amen indeed. There you go. Yeah, I mean, it's so true, and it's so frustrating, but I'm so grateful for you all and the work that you do to push us, to push government, to push legislators. And I think one of the things that frustrates me is we get these fiscal notes on all the legislation, and they have this at the federal level too, right? And it tells you what something costs to do, but it never examines what it will cost to not do, right? It never takes into account your ROI. It doesn't take into account, well, if we don't do this, here's how much it's costing us currently to have this unhealthy housing. It may cost this much to fix it, but it's so frustrating how we measure our expenditures these days in Annapolis and in DC, and I assume in every state capital. It's a very frustrating process because it really obscures the value of the legislation that's being brought forth, right? It tells you the monetary amount, but not the actual value and the worth. So it's really frustrating.
The fact that child poverty alone in this country costs over $1 trillion.
Right. Yes, that is not a measure that gets put into, right? And we don't follow how much it's costing us to have a child be born to a mother who didn't get adequate health care, was underserved, and then is in a house where she has asthma, and so she misses school days and isn't able to take the AP classes that she could have taken, and she is clearly smart enough and capable enough to take, but she's missed classes. And then, kids don't realize their full potential and the cost of that to all of us and to society, right? I think
the mother of the other Wes Moore.
Yes, right.
Who had the opportunity to have a Hopkins education.
Right.
I mean, these things happen to people, if I got that right, Wes.
That's exactly right.
But, we can tell these stories, or we can tell different stories with the opportunity, but I think you're right. And I want to say one thing about voting, right? Voting matters, and voting, whoever you choose to vote for, but what matters is what will they actually do? Because, we've got to have systemic change in how we spend our money, how we prioritize our budgets, and, that we've got to have leaders who say budgets are a reflection of our moral compass. And that has to be, we have to hold that accountable to everything we do, how we spend our time. I'm re-looking at who will GHHI be after post-COVID? We're making decisions to ensure that everything we say about what we're doing is reflected in all that we do. And I've got a great board who's helping to lead that and do that. But we all have to take that measure and take this moment.
Yep. Well, a huge thank you to both of you. I don't know, Wes, if you want to say a final word and then we'll sign off. Thank you so much for joining us today.
No, my only final word is, please, let's not lose imagination and let's not lose hope. Not now. Yep. The light is there. We've got to keep pushing. Just push even harder.
And buy the book, everybody. Buy the book.
Buy the book, yeah. No, but a huge thank you to the amazing Wes Moore, Ruth Ann Norton. Thank you so much for joining us today. Everybody, thank you for your time and your thoughtfulness and your work on all of this. As we reopen the state from a pandemic and respond to a national cry for racial justice, it is incumbent on all of us to reimagine it the way that our world works and the way it looks. And I hope that we can all, rededicate ourselves to making sure that tomorrow is much better than yesterday. So thank you all. Thanks so much for joining. Take care. Be well. Stay safe.
Stay safe. Thank you. Thank you. Thank you.